This is MedEvidence, truth behind the data. In this episode today, Dr. Michael Koren and Dr. Mitch Rothstein are kicking the nicotine habit. It's a brain thing. But first, Dr. Michael Koren is a practicing cardiologist and chief executive officer at ENCORE Research Group, which conducts clinical trials across Florida. He has been the principal investigator of over 2,000 trials and has been published in the most prestigious medical journals. Dr. Michael Koren received his medical degree cum laude at Harvard Medical School. Also joining us today is Dr. Mitch Rothstein. He's practiced clinical pulmonary and sleep medicine for over 30 years in Jacksonville. For the last 6 years, he has transitioned into clinical research as medical director of the Phase 1 unit at Jacksonville Center for Clinical Research. Now, be sure to subscribe to MedEvidence for weekly notifications. So, gentlemen, as we've discussed in the previous segments, we've talked about quitting, we've talked about why we should quit, but what about medications to help with quitting? Besides like the patch, what other options are there?
So since you mentioned the patch is nicotine replacement therapy. And so there's other ways to do that. You can either do the patch, you can do chewing gum, you can do vaping, nicotine as well. Vaping has some side effects with just the idea that you're, again, superheating an aerosol, superheating a liquid to turn into an aerosol to deliver the nicotine can cause damage locally to the mouth, depending on what other chemicals are in the liquid that's being superheated. That can cause damage to lung tissue as well. And overall, from all the studies that are out there, people who use nicotine replacement in any form, with or without behavioral therapy, have quit rates that kind of get toward 6 or 8%. So it doesn't seem to be that effective by itself. However, we always tell our patients, and Mike, I'm sure you tell your patients too, if you're using just nicotine and not smoking cigarettes, that's better for you than what you were doing before.
Yeah, I think most clinicians generally believe that we much prefer people use nicotine replacement products than to smoke cigarettes. There is some controversy in the public health space about that. There's some hardcore public health people that say that people are never really free of the habit if they're just replacing cigarettes with nicotine replacement, and that ultimately there's a high rate of going back to smoking. And, it's an argument that happens back and forth. But in my point of view, and I know Mitch Rothstein agrees with me on this, is that we just don't want people to inhale burned tobacco. Mm-hmm. And then the way they get that nicotine is always subject to discussion. Some people like the patches, some people like the gum, some people like to inhale it, and there's lots of different options. They're over the counter. When this started, you need a prescription for these things. You don't need that anymore. So they're widely available. And I guess we'll talk about some of these other newer delivery systems that heat tobacco rather than burn it. Mm-hmm. And some public health figures think that, while they're not crazy about that, at least you don't release all these toxins. So when you burn tobacco at very, very high temperatures, you're releasing 3,000 toxic, horrible chemicals. But you don't get that same distribution of these chemicals when you just heat it to a lower level. So I guess the difference between baking and broiling.
I'm not really that familiar with the heated tobacco model for nicotine replacement therapy. Mm. So it's mostly in Asia.
Yeah, it started out in Asia, but I think it's IQOS is what it's marketed under here in the U.S. I believe it's been approved in the U.S., although there's some controversy about it. Yeah, it's pending approval. Yeah. Yeah, so I know it went back and forth. I remember reading some stuff from the FDA about it. Mm. And again, this is the controversy about whether or not it's truly beneficial. Is it a bridge to other people to give them a sense that smoking is less harmful than it really is? There's that concept as well. But it's definitely approved in Asian countries, and I know there's in some European countries, and there's some discussion here in the U.S. I know, and I've read some things back and forth. I don't know where it stands exactly right now.
Mm-hmm. Yeah. So, but what is it then? An e-cigarette? Is that just a electric cigarette, right?
And that's vaping essentially.
Oh, okay, right. It's not the little vapey pipe that I sometimes find when my college kids come to my house. Yeah.
E-cigarettes have a multitude of different forms. So when they first came out, they were relatively large, and it looked like somebody for lack of a better word, had a bong that they were smoking in their car, because there's a lot of aerosol that comes out. The device itself was very large, but there's smaller ones that you can get also. And it depends on, the particular, one of the things about smoking is, again, the draw of the cigarette, that how it feels in your mouth, and that people have very particular likes and dislikes, and that will make them buy either larger electronic cigarettes or smaller ones. Just to mention one other thing about vaping is there was lung injury that was associated with the vaping about 5 or 6 years ago. And
the popcorn lung,
Right, we used to call it ALI, that acute lung injury from acute lung injury from vaping. But it turned out that it was only when people were vaping cannabis. It wasn't vaping nicotine, because the cannabis oil that they were using had this vitamin K in it. And when they aerosolized the vitamin K, that was doing the damage to lungs. So the nicotine vaping didn't see that happen. These were just in people who were vaping cannabis.
Yeah, and just to be clear about the point I made before, is that when you're vaping, it's liquid nicotine. It's not tobacco. Whereas the IQOS is actually heating tobacco. So one of the theoretical advantages of that is you'll get more of the taste of the tobacco. And you get the nicotine, but not the other toxic carcinogens.
Right.
And so, if I remember correctly, they determined that at that point where you're releasing a lot of the carcinogens is something above 500 degrees. So the heating of the tobacco is at 500 degrees or less. And again, this is being looked at by the FDA, and by the time people listen to this, it may or may not be approved.
Right. Well, and I know with vaping, it's all about flavors, and there, some have smoke and some don't. I was at a baseball game and they're like, no vaping, no e-cigarettes, but you totally see the smoke going next, a couple rows down. It's like, that dude's totally vaping. But where's the smoke coming from that?
So that's water vapor.
Okay.
Steam, essentially, is what you're saying.
All right.
Yeah, and I don't know, Mitch, is there anything that looked at using vaping as a cigarette quitting strategy versus other nicotine replacement?
In fact, the most successful quitting strategy with nicotine replacement is through vaping.
Okay.
So, and for all the reasons that you brought up, it's relatively new. We know that there's people that will relapse and go back to cigarettes again. But there's also, when you look at high school students, it used to be that among all high school students, 2/3 of high school students would try smoking. Of the 2/3 that tried it, there were 20% who became addicted to smoking. And over the last 10 years, that number for cigarettes has dropped down to like 6%. But now 30% of high school students are
vaping.
Interesting.
So there's still a lot of nicotine use out there. And maybe this nicotine use, no one's obviously endorsing vaping is a good thing to do yet, but maybe it's not as harmful as the burning tobacco.
Right. And I think that goes back to what you talked about, the stigma of smoking. It's kind of gone down, or it's gone up. There's a definite stigma, and that high school students are saying, "Oh, I don't want to smoke. Ew, smoking's gross, but I'll vape all day long." That to me is what I see more, having been a mom of high schoolers.
Yeah, it's interesting, and there may be a generational difference in this. So when I see people smoking, I said, poor guy got caught up in the culture when he was in high school, and I was stuck with it. When I see people vaping, it says they're just trying to get a chemical in their body. It's like this is all about the drug, and I don't know. To me, that's just as bad, and it's stigmatized. But maybe that's not true for younger people. They may not see this as just drug seeking behavior.
Yeah.
And of course, getting a cup of coffee is drug seeking behavior as well. So, when I think about it objectively, it may be not that much different.
Right.
But still, that's where the cultural elements of the stigma come into play.
Can I throw chewing tobacco into this conversation at all? Can we just talk about that? I went to college in Colorado. It was a big thing to have that big old bunch of chew in your lip. Let's...
Yeah, I mean, it's the same basic addiction to nicotine applies there, too. You just have different consequences. So with the big chew in your lip, the nicotine in your body lasts longer because it's always being released into your bloodstream while you're chewing. And the downside of it, obviously, is that, instead of developing lung cancer or heart disease, you develop oral cancer and tongue cancer. And, it's like pipe smoke. It's all kind of the same. The chemical effect of nicotine is still mediated through dopamine. It's just the delivery system is different, and the associations that you make with the use of nicotine differ depending on the delivery system.
Yeah, I mean, it's still hitting the same receptors in the brain and doing the same release. Right. All right. So what else about some of the quit smoking meds? Is there a pill?
Lots of pills. we have pills for everything.
Yeah.
And we've done this research over the last 20, 30 years at Jacksonville Center for Clinical Research, and Dr. Rothstein and our other colleagues, Dr. Jack Mine, are involved in these smoking cessation trials as we speak. So if people are interested in that, give us a holler. But the strategies are really where we can start the conversation. And the strategies that we're now looking at are sort of fooling the brain into thinking that it's getting what it needs. So the same things that satisfy the brain in terms of dopamine receptor uptake are being applied. And so the product of the market that people talk about is Chantix, and that it was developed. I think we actually did a study or two with that back years ago. But we're now, as we speak, involved in some of the studies that are looking at similar mechanisms, and I'm sure Dr. Rothstein can talk about it in a little bit more detail.
The cytosine or cytisicolline study that we're doing now is also a nicotine receptor blocker, agonist, partial antagonist, and it takes the space where nicotine would land, and it lets the person experience some of the dopamine euphoria from having another agent there. And the study that we're involved in is actually a third phase study of a drug that's been out in Europe for about 30 years and has been associated with much higher success rates for smoking cessation than any of the products like Chantix or bupropion, Wellbutrin, that we've been using in the United States. And in this particular study, we're looking at patients being given either the drug 3 times a day for the course of a 12-week block, 6-week block, or placebo. And the way the study is designed is that one group is going to get a couple rounds of placebo, one group is going to get a round of the medication, then a round of placebo, and then another group is going to get 2 rounds of the drug, and we're going to compare quit rates early on during the first 6-week part of the study, as well as during the second 6-week part of the trial, and then a year later on. And because of the success rates on some preliminary studies done in the United States, as well as lots of studies done in Europe, we're very kind of excited about this. This seems to have at least as good an effect on helping people stop smoking with behavioral therapy. So all the patients in this study will be getting behavioral therapy as well as Chantix does, and with seemingly a smaller side effect profile.
Yeah. So there's a lot of exciting details for the study, but in the interest of time, I'm going to have to ask my questions in the next segment.